I'm going to say a special shout out to some of my former NYPL colleagues. So good to see some of you joining here today. Friendly face, well, friendly names. All right, let's go ahead and get started. Carrie, do you want to share your screen? Thank you. All right. Hello and welcome, everyone. Thank you so much for attending the meat of our conference yesterday. We had a fantastic time and we hope everyone did as well. We also welcome any feedback that you would like to provide us with. The conference will happen every year, and so we are always looking for ways to improve. So please do not be shy. So today is going to run very differently. I'm going to give a couple of quick announcements, and then I'm going to hand it over to our friend David, who's going to do a demo on Vooks, which was the announcement we made yesterday. And then what we're going to do is break out into a few different rooms to discuss some of the panels from yesterday based on the poll that you completed at the end of the conference. All right. So first, we mentioned this yesterday, Goldie did, about our New York City Health and Hospitals partnership with the Test and Trace Corps. We just wanted to highlight it because we think this is something great to share with either your patients or your patrons, whoever you may be seeing, that if they test positive for COVID, they're able to request a Take Care kit. And that Take Care kit now has books and art materials and all sorts of fun things for children in there as well. And that's a huge huge thank you to our partners, Cities First Readers. Also, a couple of others. We have the Children's Museum of the Arts, Literacy Partners, and I am blanking on one of them, Imagination Neighborhood, a podcast, who's going to be sending out some stickers as well. So we are very excited about that. And if anybody has any connections or ideas on things to also put in the Take Care kits, please don't hesitate to reach out to us. I know we are always looking for things to help support our families. Unfortunately, I will say this is only for New York City. So for our friends in Long Island and in the greater Hudson Valley, unfortunately, this does not apply. However, if you have connections there with something similar that we could do in your catchment area, let us know. We'd be more than happy to try to start this partnership up there as well. And then we're also giving out books at the Test and Trace locations. You can see that's what that photo is here of the resource navigators who are giving books, as well as early literacy guidance and materials. All righty. Yes, and then the last thing are the hotels, sorry. So we've been donating some of the used books that we haven't been able to give away due to COVID restrictions, and Test and Trace has been sanitizing them and doing little rolling mini libraries in the 5 hotels. So. All right, so this is a very exciting announcement. We are launching Reach Out and Read of Greater New York 2021 awards. I know in the past we have done some awards at our gala. Obviously the gala is no more, at least for the foreseeable future. But this year what we really wanted to do was create a number of awards that can really highlight the work that every single one of you are doing every day. We're just blown away by all of the support you've provided to your families, how you've adapted, and all sorts of different ways. And we want to recognize you for that. So we have different sponsors for each of these awards. Scholastic is one of those sponsors. And we're working on getting some others. But with each award winning, you'll get a certificate. You will also get a donation of books for your site. We're still working out the exact number, but your site will receive more books. So we have 5 different awards, and they can go to either one particular person or a group of people. And I will say, I have a feeling we're going to get a lot of nominations, which is amazing. And so we're more than happy to give out awards to 2 people if we get some outstanding applications. So you can see the descriptions of the awards here, but I'll run through them really quickly. The first is the COVID-19 Response Award, someone who really went above and beyond to meet the needs of their patients during this time. You co-hosted parent caregiver workshops, making sure everything's available in multiple languages, promoting ROR on social media, just really met the COVID-19 challenge. The Trusted Messenger Award is about creating supportive and lasting relationships with children and their parents and caregivers. Is their patient's ultimate trusted partner for all information regarding their children. I think that resonates a lot with the 2 panels that we had yesterday as well. Advocate for Diverse Books Award, what I am most excited about. So constantly providing high quality, diverse books, advocating and speaking up for diverse books, anything that has to do with making sure that every community is represented and every language is represented in the books that we supply our families. The Living, Breathing ROR GNY Award. This person or persons goes above and beyond to ensure that nothing can stop ROR from happening at their clinic. Floods, natural disasters, COVID, all of these things just embodies Reach Out and Read. And then the final award is the Whole Family Advocate Award. It's about going above and beyond to connect families, not just their kids, not just early literacy resources, but making sure that their parents are supported as well, whether that's supplying mental health resources or English classes or whatever that the adult needs in that child's life, making sure that they're supported as well. Because after all, we know that grown-ups need to be able to take care of themselves in order to be able to take care of their kids. So we are going to drop the nomination form. It's a pretty simple form in the chat. Carrie just added it there. But we will also send it out in a follow-up email. And I know we do have some participants here today who are not from the Reach Out and Read Network. These are going specifically to Reach Out and Read staff. You do not have to be a doctor to receive an award. However, just because you do not work with the Reach Out and Read program doesn't mean that you can't nominate. And so please feel free to nominate a doctor, a coordinator, anyone within the Reach Out and Read family. We are very excited. This will be our next town hall will be in June, and we will announce the winners there. And the winners will be selected by our programming committee, which is comprised of board members, as well as some of our pediatricians, and also different early childhood experts and parents from the greater New York community. So right now there's about 13 different people on that committee. And then also some ROR staff, myself and Emily are on the committee as well. So we are very, very excited to read all of the nominations and learn more about the incredible work that you do every day. Alrighty. So now I am going to hand it over to David, who is going to tell us all about Vooks and the insanely generous donation that Vooks is giving Reach Out and Read of Greater New York of 75,000 free logins for 1 year, which is just, oh my gosh, incredible. So thank you, David, and please take over.
Of course, thank you so much. Thank you all for having me. As Kristen said, I'm David from Vooks. If you're not familiar with Vooks, we are a company based in Portland, Oregon. And our goal is really just to, I like to say, to chase kids back to books. I think there's it's very competitive these days, and with screen time, and we try to be intentional around the screen time that kids have. And so I'm going to give you a little bit of a demo of the platform and share a little bit of a book, and walk you through the partnership and kind of how we're planning on rolling this out. Can everyone see this? Awesome. So this is Vooks. What we do is we partner with publishers and authors to bring children's storybooks to life through slow-paced animation and read aloud material where we highlight the words on the screen, which you'll see in a second. We also, a huge part of what we do is trying to encourage parent-child interaction when it comes to reading. And so what we have for most of our books, and soon to be all of them, are both lesson plans and educational resources. And I'll give you let's see, what's a good one? There's a Curious George one. So what we have is all the information that you'd like if this is for a teacher or for a parent, or in this case, even some of our doctors. And so what we really want to do is get kids engaged with the material. And so there's questions to be asking the kids. And then also what we've kind of come up with, and I think we've patented it, is something called pause and ponder. And so this is a way to get to pause at each point during the book and ask a child a question to engage with the story. And so we have a group of teachers, or ex-teachers and ex-scholastic people that have made these, who go through the books and help write this. And like I said, it's really what we've taken is kind of looked at what's missing in the industry and in both in education as well as technology. And we try to fill that gap. And honestly, we really just want to see kids excited about reading. And I like to say that Vooks is a good sidecar for books, because we're not trying to replace them. We're actually trying to get them to get excited about the physical book and go get it. And so, as Kristen had mentioned, a reason for our partnership is we've seen so much in the last year where places and resources that children, especially in underserved communities, would have access to books are being depleted, and we're not even having that face time with kids. And so we thought this would be a great opportunity for doctors in the Reach Out and Read network to show a book to a child during their appointment, and then give the family a free login to use at home, and so to walk them through and kind of introduce them. And so I'm going to show you just a quick book, or a little bit of a book, because I don't want to make anybody actually sit through it. However, they're pretty nice. So let's make sure I've got this. All right. Can everyone hear that?
Party Nazari's Fantastic Future. Oh.
Hey, Nazari, what would you like to be when you grow up?
What tantalizing things await me? Ooh. Ah. Daddy, what about doing what astronauts do and fly to a new planet?
Whoa! Houston, this is Nazari. Do you copy?
Or I can be a farmer and make sure the food the world eats is organic. Yep, good crop season this year. Daddy! What about being a construction worker and building homes for all? Going up? Whee! Or I can be an engineer and make a bridge to the moon that won't fall.
All right, sorry to cut that off. I will say it's still weird for me to show children's books in meetings like this and watch a bunch of adults watch them, but it is kind of exciting. Yeah, so like I said, one of our big goals is really to slow down that the stimulation. I used to work for Apple, and while I was there, we did a study that showed that children weren't retaining the same amount of information in physical books because they were being overstimulated in YouTube videos and cartoons. And so we really tried to be intentional in, creating a slow pace animation on the screen that actually can show a correlation between the words and allow for retention to speed up. We're actually currently doing a partnership with Carnegie Mellon's Early Childhood Education Department to really understand, I guess, prove a lot of our assumptions. And everything's been going great. They were actually doing a project before this about something like Vooks. They didn't know it existed. And so in a lot of ways, Kristen had mentioned yesterday that somebody had said this would be a good idea to create something like this. And so we found out that in a lot of ways in this arena, we're kind of the best kept secret. And so we've only been around for not quite 2 years yet. And we put out around 6 new books every week. We've actually, since this is being recorded, this is technically off the record. We'll be seeing a lot more popular content coming out with partners like Disney. And as you go through some of the books, you might be familiar with some of the voiceover. We've got partners like Kate Winslet. We just recorded one with Rainn Wilson, if any of you are The Office fans. And so we're just really seeing that this is coming to the forefront of a lot of people's attention, that our children are falling behind. And so it's a huge honor for me to partner with Reach Out and Reach with Greater New York to just make sure that these children in underserved communities are no longer underserved, at least when it comes to the resources that we have. So Kristen will make sure that we have everybody's email address. We'll make sure that every doctor and every provider in the network has a login, as well as I'll record a little video of how to sign up and set up your own account, and then how to make sure that we can play these in each of the appointments, and then make sure that each family has access for a year. And realistically, my policy internally, I used to run the growth side of the company, but in the last year, my heart's kind of been stolen by the lack of resources in underserved communities. And so now I head up just the impact side. And so my goal is to say, if you can't afford it, you can have it for free. But if you can't afford it, we're going to make sure you pay for it so that those kids can have it for free. And so as we continue to grow, we want to make sure that these children continue to have access, because it's not necessarily, well, I don't see it as charity. I see it as permission for a better future. And so we believe that especially the read aloud aspect, as well as strong material when it comes to literacy, is so important to a lot of these underserved communities. And we say, realistically, it's a 1 year free, but there's about a 99% chance that this will be a lifetime. We just like to check in annually and make sure that they're being engaged with this. So I guess that's the end of the demo. I told Kristen I was kind of just winging it, so I didn't have much more planned. But if anybody has any questions, I'm happy to answer them. Other than that, I'm looking forward to having you all on the platform.
We do have, thank you so much, David. That was fantastic. We're, like I said, we're very excited. And, the responsibility of our medical providers and coordinators is just going to be that making sure families, when they get the promo code to sign up for free, that they actually sign up. And so that's really all that we ask. And there are hundreds of books on Vooks and popular titles. And it sounds like we're getting more popular titles. So it's just a great platform. I love it. There are no ads. There's nothing that's going to pull you away from the book. It's just the book that you're watching, which I think is very beautiful. So I see one question in the chat that says, oh goodness, where did it go? Are there any activities at the end of the stories to gather reading comprehension data?
Currently there are not. We just have those learning resources and lesson guides. I said those backwards. Lesson plans and reading. Okay, now I've just lost those ones that I showed you at the beginning of it. But we're continuing to build things. And so originally we were actually built off of the Vimeo platform. And in the last month, we launched it in the last month, but for the last year, we've been working on creating our own backend so that we can track more information for teachers. But like Kristen said, it's all ad free. All the data is owned by us, and we're really just trying to create a protective space for parents. But as we continue to grow, that's been something that we've put in and high on our list as far as what we want to prioritize, because it really is about the retention and the information. And so after our project is finished with Carnegie Mellon's department, we'll be having at least more of a North Star of what we should be adding and keeping. So
fantastic. Love that it's research based, and you're improving, based on feedback. I think that's so important. So this officially launches March 10th. So be on the lookout for an email from me or someone else on the Reach Out and Read team with all of the information to create an account and to get the access codes for your patients. We can't wait.
We had
one more question.
Yeah, that's what I was just gonna say. I've got it pulled up now. Yes, so there are ways for age-specific books. So the ages that we really cater to is 0 to 8, and a lot of the sweet spot is really that 3 to 6 age. But as we continue to put out more on the platform, we really see it kind of across that whole spectrum. We do have some that for a little bit older, but that's really kind of our sweet spot to really catch the engagement early. And so we have channels on there that you can search by based off, like early or preschool. We have them broken down by that, as well as subject matter as well. And so as we continue to grow, one of our original investors and somebody who's very involved, and we're launching his biography, is Michelle Obama's brother, Craig Robinson, who you may know in the New York City area. And so we've got a biography coming out by him about him and his mom, and so he's a channel champion, is what we like to call it. And so we'll continue to see partnerships like this, where we just try to get stories with people that both parents and children recognize, that are stories that we're all proud, and I feel like people need to hear more. So there's ways to search by a lot of different topics and age ranges as well.
And then we also have a question about, are books available in different languages?
Currently, no. That is something that, because we're such a young company, that's something that we're in the works of doing right now, and we should see later in the year. But that's been a huge priority for us as well. So one of the things that during the process, not to get too much into the weeds, but so we partner with current publishers, and I do believe we have a couple Spanish titles on there, but eventually we'd like to have it so that you can actually change the language on each book. So that's something that we have in the pipeline currently. And there's just some regulations that we have to go through with publishers, because a lot of it is not our actual material. We're actually licensing the rights from publishers. So we're in the process of both, similar to what Netflix had done, creating original content, but making sure that there's popular titles that people recognize as well. And we'd really like to have, I think by the end of next year, 5 languages on the platform. So we're going through that currently right now.
Which 5 languages?
As I was saying that, I was worried that you were going to ask me that. I do not have that off the top of my head right now. Whatever the 5 most popular languages.
Okay.
We've seen this last year, we saw this being used as an ESL tool around the world, which it was not our original intent. But we are now currently in 180 countries around the world. We have 1.3 million teachers around the world using this in their classrooms. And honestly, it wasn't something that we necessarily expected. We also didn't expect the pandemic to come when it did, and just saw this be an incredible resource for teachers. And, while we really do actually, this is built for at-home use because we feel like that's where kids need to be being read to. Teachers just saw this as a great opportunity to use. And so honestly, we've seen so much in the last year that most parents around the world are actually teachers now too. So,
and as we love to say in early childhood, a parent is a child's first and most important teacher. So
yes, I didn't know that one, but I like that one.
Please feel free to use it. Does anybody else have any more questions? All right, not seeing anything come up. We know how to get in touch with David very quickly. So if you do have questions that come up, please shoot them our way, and we will make sure to get them answered. And be on the lookout for an email from us within the next week about a week, a little more than a week, less than a week. All right. Thank you so much for joining, David. You're more than welcome to stay for the discussion, but I also know it's relatively early over there for you in Portland.
I do have to hop to something and say goodbye to my wife before she leaves to work. But thank you all for having me. And it's such an honor to be partnered with you.
Thank you so much. We're so grateful.
Talk soon.
Bye. Alrighty. So we hope everyone enjoyed that. We're very excited to get this platform launched and really helping as many of our New Yorkers as possible get more access to more books. And one of my favorite things that he said was that he really sees this as a sidecar to physical books, and Vooks is meant to bring kids to want to read and to want to pick up those physical books. So it's not about replacing the physical book, it's just about creating that love of books and love of reading, which is why we are aligned in this partnership. Okay, so next we are going to move into breakout rooms to talk about the panels from yesterday. So those that stuck around to the end of yesterday, we did a quick poll. I think around 40 people answered the poll, and we asked what people would want to discuss in breakout rooms. And the poll was actually very, very evenly split. So what we decided to do was combine a few different things. The most popular answer was about figuring out ways to highlight parents' strengths in what you do, whether that's in the pediatric office or in your nonprofit setting, library, wherever you may be. And so using that as an umbrella and a guidepost for the conversation, what we'll do is then talk about the meat of the two panels. So addressing parent literacy, as well as language barriers, looking at it through the lens of highlighting parent strengths, as well as using books to discuss race and racism, while using as a way to highlight parent strengths as well. So Carrie is going to bump us into, let's see, we have 24 of us. So three different breakout rooms. And we'll be in there for about 15 to 20 minutes. And then we'll have 10 minutes at the end to share out. And again, we are taking notes and recording, although I don't know if the breakout rooms are recorded or how that works exactly. So bear with us on that one. This is a new venture.
And then Carrie, could you send those messages in the chat potentially? Or the questions I meant to say in the chat?
Good point. Thank you.
So we have the reference.
They're both in that last message that I sent. All right, we've got 3 breakout rooms ready, and we'll meet back soon.
Michael, we can't be in the same room.
That's exactly what I was just thinking. I don't know what happened.
There we go. Hello.
Hi, everybody.
Good to see you, Claudia.
Good to see you too, Kristen.
You're always so brightly dressed. It makes me happy. Love it. But even in the dead of winter, so.
We got to do whatever we can that is going to make us smile. I was admiring your lipstick today.
Oh, thank you.
Love it.
Thank you. Yes, that was my thought with the lipstick as well. Brightness.
Yes.
I've been in sweats and muted colors for too long, I think. All right. So, and Karen, it's good
How are you?
I'm good. How are you? So
Okay.
good to see you join. Karen and I
Yes.
used to work together at NYPL.
Yeah.
All right, so should we get started? We don't have to follow this exactly, but we really want to use this as a time to kind of debrief and talk about what really hit home. And, you know, if there's something particular happening wherever you are in relation to these topics that you really like help problem solving, that's something that we can definitely do. So does anyone want to start with anything in particular? All right, crickets. It's fine. It's Friday. That's that's honestly how I feel too. We also had our quarterly board report due today, which is a 30-page packet. So I am all sorts of slightly delirious. But okay, so let's start with this question then. What was the one takeaway yesterday that really stood out for you? What was that one thing that you're like, oh my gosh, this is the thing that I was so happy to hear?
I mean, for me, I think it was the fact that people are paying even closer attention to a topic that has been important to reach out and read all along. Because that's what I've been saying to people is this has been one of our core messages in terms of always making sure that we're representing the families that we serve and everybody, and that there's equal representation, and that I think also it's important to include it as part of the training of providers and the residents in terms of how to have these conversations with families, how to have those conversations among themselves, right? Because I think it can be hard. Everybody has their own implied bias, and sometimes people shy away from having those conversations, whether because they're not comfortable or they don't know how other people are going to react. And I think it's just important all around to be able to role model this sort of conversation starting points, to be able to open up that box, you know, and have honest conversations about it.
Definitely. Something that I've seen, at least in the some of the virtual site visits I've done and in-person site visits, I've done so few, but I have, is one thing that I think is so interesting to me is the difference. And I think this applies whether you're in a hospital, clinic, or a library, is the difference amongst the staff, right? One person, you know, I can talk to one pediatrician or a director like Claudia, and you're like, duh, of course, I've been doing this all along. Like, this has been part of that core piece. And then I occasionally will talk to a pediatrician who will say, oh, this is not my responsibility. I'm a pediatrician, you know, I'm happy to give out diverse books, but this is not something that I see as part of my job. And so for me yesterday, it was really interesting to hear from, you know, multiple doctors that this is something that they can do in like just incorporate into the visit on how they talk to the families that they're serving, in addition to the books that we give. So I was happy to see that. But Claudia, I do think you're right. We need a training, right?
So I'll talk a little bit. So I'm Mary Choi. I'm actually a pharmacist and author and educator. Yeah, so I'm like, I just found out about this conference through Twitter, and I thought it was like interesting. So I'll come and see.
Twitter works. Sorry,
yes,
it's so happy.
I made so many connections through Twitter. I mean, it's been really, really amazing, and I'm fairly new to Twitter as well. So I only joined because I became an author, and my book was published actually right before the pandemic. And It's called Healthcare Heroes, the medical careers guide. And I've been kind of going around, virtually teaching youth on different healthcare careers out there, and what are some of the healthcare professionals, what do they do? And so I just thought it was kind of interesting to see that I've never heard of this program before. And prior to this, I was a professor in pharmacy and I actually had a clinical practice site at Metropolitan Hospital, as well as other hospitals in Long Island. And so I haven't heard of this, but I also think definitely there might be a lot of other pediatricians that also haven't heard of this as well. And I have networks in Queens, Manhattan, and Brooklyn who definitely I will share the good word about your organization. And I think definitely the training component of it is important for the pediatricians in learning how to, also dealing with parents and also literacy. Not everyone might be on board with this immediately because it does take time out of offices and visits and all of that too. But I just think what all of you guys are doing are really absolutely fantastic.
Mary, as someone who educates medical professionals, do you have any tips or recommendations on how to incorporate this into a training?
So I also think it would be based off of where they serve. Mm-hmm. So in just looking at, let's say it's Lower East Side, Asian community. I think it depends on which community you're talking about too. And I think maybe you might need diverse groups of people to come up with the training in terms of okay, if it's going for Asian community, if it's going for African American, Latino, depending on where the demographics that you're targeting and where the clinics are, then I think you might need some sort of expertise looking at what the best reach is, what are some of the gaps to that they deal with, or struggles that they will deal with in the daily clinic life. Because I think every pediatrician and that deals with the different communities have their own issues at hand. So we have to figure out what those issues are first to kind of do the training around that.
Mm-hmm. That makes sense. Super customized training. Mm-hmm. Yes, I like that a lot. That's definitely something we can work towards. Wow. I'm so happy you found us, Mary. We don't have a social media person, so I'm also wearing the hat of social media manager with a volunteer. And I am not at all a social media person. So that makes me so happy that you found us. And I'm gonna go buy your book. I gotta check it out. Healthcare Heroes, so appropriate for all of this. So I know, Catherine, you're here as a pediatrician. Is there anything that you would like to add to this conversation?
I was very glad yesterday to hear that as a program, we're aware of the difficulties of the last year through the pandemic, and about, we continue to give as soon after the pandemic started last March, I would say in May, we started giving books again. Mm-hmm. We had stopped, no one was sure what was happening, how the infection would spread. So we started, but the whole waiting room issue about providing literacy material in the waiting room and so forth, our goal is for patients not to be in the waiting room, not to wait. That's our goal for every appointment that we make. And we've gone back to almost full appointments, full schedules. Yes, almost full schedules. So despite that, we're trying not to have patients wait in the waiting area. We've had quite a few, I think, innovative things that we've done, including extended hours and Saturday hours and even Sunday hours last year.
Oh, wow.
To accomplish that. So, but again, I think that that's a major, you know, the waiting room or literacy, other things that are helpful to parents that we cannot do during the visit. Of course, we never wanted a parent to wait long in the waiting room.
Of course.
but while they're there, it was great to have volunteers, which we cannot have now, to read to the kids and to have all those books there that they loved and they wanted to take home, in addition to the book that they got in the exam room. So I think, you know, and I loved the Vooks idea today. And I'm thinking, I know it's to give to the parent, but I'm thinking, can we use it in the waiting room? So we, you know, we have, you know, TVs, obviously, where's the place where there isn't a TV? But, and we, you know, we try to put up educational videos and material, but is there another, you know, could we use Vooks there? I'm probably not, because you have to choose the book and so forth and so on. But it just seemed like the slow-paced reading of the book, out loud reading of the book, with the slow-paced animation. I mean, it was really something that you don't see, like David Becker said, you don't see it on YouTube and all those cartoons and stuff that kids watch, even the educational ones. But I think that's our main concern. I mean, we are giving books. And of course, the realization that kids are, you know, they're affected, you know. And I mean, we know that there's going to be reduced literacy in school-age kids, in addition to, you know, the psychological damage being done by, you know, the isolation of remote learning. So, you know, I think we can really, Reach Out and Read can really play a big part in, even in that age group, by starting young, because these are families with kids of different ages. And I think it can really help.
Definitely. I love that idea of the books in the waiting room. I'm wondering, I'll shoot David an email and see if there's something that, you know, because each medical provider is going to get their own account. So I wonder if there's a way he could set up a playlist, right, of their books that could potentially just run, right? Or like a couple of different options of playlists that could be special for the waiting rooms. I mean, it can't hurt to ask, so.
Yes. Right. That could, that idea. Yes, right. Where you're just playing the books, just playing the books, and whatever parents happen to be there and kids could be watching, and then that's like sort of an advertisement,
right?
For them, yeah.
So then when we come into the room, oh, okay, there's this. You can sign up, and you can have this, and you can read any book you want, and there's other resources there, and you know, things like that.
Right. And then they could also have, I mean, he mentioned about the different languages. So then each center can actually pick and choose what they want to do in terms of language and the age range of the books and the kids that can match up a little bit.
We just recently were able to bring into the clinic the books we received last year, the bilingual books we received last year through Reach Out and Read, with, I mean, all the languages that we needed: Bengali, Arabic, Haitian Creole, French, and did I say Arabic? Yes. I mean, it's just, it's amazing, the response. And one of the parents this morning said to me, do you know that the words used are proper language words that I don't use in everyday life? You know, there's a Faces, one of the Faces books was translated, and it has like laughing or crying. And she said, you know, some of the words are proper Bengali, and I don't use it in and when I saw it, I was like, wow, I should tell my kids, I should talk to my kids this way and introduce them to my proper language. It's amazing. It's amazing. It's great for the parents. I mean, the kids, they don't care. It's great for the parents. I mean, they don't care, meaning that they're not reading, most of them yet. So it's really amazing for the parents. Amazing.
I'll tell you, you have to make sure that the content of the book grabs the parent as much as the child. You know, we talk so much about child-directed learning, which is so important, and research has been done on this, and we need to make sure that, you know, the topic of the book is interesting to the child, right? So that the child will want to keep reading. But on the other hand, we have to make sure that the adult enjoys it as well. So the adult is excited to sit down and to read with their child. And those, I think, are the best books.
I think that's why the bilingual book, that's the major role, I think, the bilingual book, because when they see all of a sudden their alphabet or their in written form, they're like, oh my God, it's so thoughtful. And it also appears like we're very thoughtful, which we try to be, of course, but it's like, oh, you really thought about me?
Yeah.
You know, that I'm not English fluent and that, you know, I would enjoy reading this book with my child. Is really amazing, amazing.
And I think that speaks directly to bringing in parent strength, right? Of
yes.
Immediately you develop that relationship with the parent. And I forget who said it yesterday on what panel. Maybe it was Cindy from Brilliant Detroit had said, she gave an example and it was about the parent hearing her, you know, she felt heard and respected and taken care of in that moment. And no one had done that for her previously. And that's, you know, such a huge opportunity. And, you know, no matter what literacy field you're in, any relationship you have like that, you can make such a huge impact, just like you were saying with the books. I'm excited. I'll tell you a quick snippet. We actually special requested a translation of a STEM board book into Bengali. Because we noticed that there was a lack of STEM in Bengali. And so we just, it's probably going to be ready in I don't know, maybe May or June. But I'm super excited about it. It's about atoms. It's super cute. And it's going to be bilingual in English and Bengali.
Through who? Through
Platypus Media.
Yeah. Wow. It's amazing.
So excited.
Yeah.
All right, I know. Oh, okay. I want to make sure. Oh, breakout rooms are closing in 1 minute. So I'm happy to kind of summarize this and share this out. I'll share one last thought I was thinking of, you know, my fear in all of this and all that we do. And I had this fear too when I was at NYPL actually, is that we ask our frontline providers to do so much in so little time, right? And that I don't want, like, how do we balance that, right? You know, all of this is important, but to the point of Rajani yesterday, you know, she's like, I have sometimes 15 minutes with my patients. And then what do you do in that 15 minutes? And you're trying to cover reach out and read and all of these other things and making sure that, you know, the patient is happy and healthy. So that's weighing on my mind.
Welcome back, everyone.
We all back? I think we're all back.
Oh, yes.
Alrighty. So quick group share outs. I'm happy to start with my group. We talked a lot about the need for training specifically and how to have conversations around race and racism in the pediatric appointment or in general. We had, I was super excited. I'm sorry, Mary, going to single you out. Mary found us on Twitter. And she is a pharmacist and children's book author. And I gave this idea of, you know, she was also a professor in Long Island, teaching pharmacy. Yes. Okay, great. And so we asked her, tips on training and what that could look like. And she was saying that they need to be very customized, right? So the training that we offer to providers in the Lower East Side needs to look different than the training that we would offer to, the providers in Washington Heights or something like that. So looking at those pieces, another piece that we talked about was managing time in an appointment. And we ask so much of our providers to do in such a short amount of time, and how do they prioritize? And obviously all of this is important, but where, when do you get to which piece and how? And so incorporating that into the training. And then we talked a lot about, just the importance of diversity and seeing how everybody was happy that this is being, really brought to the forefront, even though it's technically been a core of our program forever. Not a lot of people were doing it intentionally. And so making sure, that we have books that are bilingual and in a multitude of languages really helps build that trust and, recognizes the parent's strength and brings out that feeling of being heard that was mentioned yesterday in the panels.
I had Gary, who was willing to volunteer to share out what our group said. So thank you again, Gary, for volunteering. And you can just share a few quick points. Oops, I'm sorry. Can you unmute yourself first?
Okay, can you hear me now?
Yes, you're good.
So one of the things we talked about is about having kids from different backgrounds see themselves in books and be able to identify when they read books. And we also talked about the panel that we had yesterday on adult literacy. And I was just sharing that, especially in low income immigrant neighborhoods, one of those areas in which I work in, that, it's really important for the moms who are not able to speak English to get bilingual books, baby books, both in English and Spanish. And we talked about the importance of that. And I even shared that I'm a non-Spanish speaking person, and I actually use those books because I'm learning Spanish. And I actually use the baby books to learn Spanish. And I think the Spanish speaking moms are doing the same thing. They're reading the books, in Spanish to their little kids, but they're also learning the English version. So we talked a little bit about that. And we talked about this morning's discussion about the Vooks demonstration by David Becker, which I thought was really awesome. But the challenge that was brought up is that someone in our group said that when they come in and we show them how to log on to the Vooks website, that the challenge may be to make sure that we give them access to do it before they actually leave the visit, the medical visit. And I think that's really important that we, because they're very busy and they do other things, and some of them may be challenged also. So it's really important, I think, that especially in a medical setting that I'm in, if I can find a way that incorporate it as part of the medical visit when they come and find some way, because they're waiting in the waiting rooms. So if we can find some way to somehow get them to log on and get all that done, that'd be great before they actually leave. So we know that they already have access and they have no issues with doing that. I think that would be great.
It's a great idea. Almost having someone, when they check in, right, set them up with that first before they go into the appointment. So it also doesn't take away time from the appointment. It's a fabulous idea.
And there's some ideas too, because some medical settings have a, you can actually log in. There's a kiosk usually in some medical settings. So you can actually put it on there as part of the actual login routine. I'm just saying, right? So there's ways around it. You just have to incorporate it in such a way. Yeah. But I think that'd be really good to be able to do, because I think that particular, that whole thing with the Vooks where, they're actually seeing the video and reading, I think it's just amazing, Yeah. I don't know if, Carrie, you have any other things to
You summarized it beautifully. Thank you so much.
Okay, you're welcome.
Really quickly before you share, Michael, I forgot to mention one of our Vooks pieces. It was talked about potentially playing Vooks in the waiting room. So I'm going to talk to David to see if maybe he could set up like a playlist or something so they wouldn't have to constantly change the book over, because even if they are in the waiting room for such a short time, and we can't have volunteers in the waiting rooms anymore, but being able to play some Vooks on repeat would be a nice way to bring reading back into the waiting rooms. And that was Dr. Catherine Balora's idea. Great idea.
Wonderful ideas there, Gary. Thank you for sharing. So, Carrie, that made me realize I didn't ask if anybody from my group wanted to share. So just like 5 seconds here, maybe Dr. Huberman or so Dr. Richards, anybody want to share? It's okay if not, I can definitely share, but rather let you guys go. So, okay, I can do it. But so basically, yeah, we had a wonderful discussion, really lively. And I think one of the key points that Dr. Richards brought up, which was actually about the Baby Bounce book that, Kristen and Carrie, we were talking about earlier, was just the idea of, an absence of a positive depiction becomes negative when juxtaposed against other positive depictions. So, something as subtle as that, just keeping in mind. And I was telling Dr. Richards how we had the discussion about closing the loop and trying to make sure we talk with publishers about something like that. And it's just helpful for all of us, to think about that when we look at these titles. Another thing was we were discussing the difficulty of finding positive books and media representation for Black boys in particular. And so just thinking about that, Dr. Richards was saying, we say the world is made for men, but often it's really not for Black men, especially. So that's an important, thing to just keep in mind. And then, still within this race and racism piece, just networking with other families and doctors and patients as a tool to find that positive representation. So just discussing amongst one another, sort of word of mouth as a way to find, these positive representations, because it can be tough, even though we have the internet now, just talking with others who have found, titles or movies or something that's positive. So that's good. And then as far as the language barrier piece, one thing that Dr. Huberman brought up was, how do all the providers feel about, giving bilingual Spanish books to, say, an African or a Jamaican family or somebody who doesn't, necessarily speak Spanish? Just how do you feel about that? And Dr. Huberman was saying, I might feel a little uncomfortable because I don't want to be not meeting their needs. But Dr. Richards was saying, oftentimes if it's a bilingual book and not just Spanish only, it could be used as an opportunity to help the child learn, the animal's name in English and Spanish, and kind of just viewing it in that light, if there's no other books available. So I thought that was just an interesting discussion about, trying to meet families' needs and with the titles that we have, because oftentimes it's not perfect. So I thought that was interesting. So thank you to my group for sharing that.
These are all great discussions and all things that we can learn from. So I know we're over time. I really appreciate everyone sticking around over. And if you would like, so first, also, I should say everything, we all took notes and this has been recorded. And so everything here today, we will synthesize and send out. And we're really just looking forward to making our programs better. And so, if you have any other thoughts that come up, please don't hesitate to reach out or wait for the next town hall. We are always happy to sit down and have a conversation with anyone anytime about improving the program. We take this very seriously. Yes, Michael dropped his email in there. I'm happy. You all should have gotten an email from me, so you should have my email. But if not, reach out to Michael and he can give it to you. But we really just appreciate everyone being open and honest and communicating. So thank you so much. We are now going to jump into an option to virtually network if you would like for the next hour. It's on a different platform. Those links, we're just going to use the first link because it fits 50 people, and we don't think that we're going to get more than 50 people in the networking space. It's kind of cool. It looks like a virtual conference room, and you can hop around from table to table. So this is great if you want to have some individual or small group conversations with a particular person and connect with them. So hopefully we will see you there. And if not, thank you again and have a wonderful weekend. Link is in the chat.